and
No,
we all need to know that.
that's good. So I will just share the screen with it. Yeah, it allowing me to share the screen. That's good. Yeah.
Yes,
Excellent.
you are allowed.
Yeah.
Okay, so that's good.
Before we start,
Yeah.
I just want to introduce you to my co-founders, Abhishek
Yeah,
Kumar, who is in Patna.
Yeah, you can give introduction about your network and what work you do.
Yes,
Okay.
yes.
So this will be a
And
good.
our one of the co-founder is your alumni also from Sainik School. He is Atul, based out of Atul. He is in California.
Oh,
Atul,
good.
if you can introduce, he is your alumni. Sir is also from Pilaiya.
Sure, sir. So namaste, Sanjeev sir. My name is Atul Kumar. 8690.
So which batch? Sorry.
San Jose, California.
Which batch you're from?
South. 8693.
86. So you're which house? You're Rajgiri house, huh?
Gotham.
Gotham.
Gotham House.
Okay.
Abhi,
Gotham house. So what are you doing in California?
Chandan, California.
So what are you doing there?
जी तो एक कंपनी चलाता हूँ रेयर वेंचर्स स्टार्टअप्स को हेल्प करता हूँ
Good.
So
I can
welcome Sanjeev sir, and
thank you.
I'll let this discussion start.
Your voice is breaking, Atul.
So I'm outside, so signal
Okay.
Can you hear now?
Yeah, a little better.
हाँ तो सर यंग एंटरप्रेन्योर्स नेटवर्क एक हमने ऑर्गेनाइजेशन नॉन प्रॉफिट क्रिएट किया था स्टार्टअप्स को प्रमोट करने के लिए कि आज के जमाने में जॉब्स की जगह ज्यादा अपॉर्चुनिटीज है और जरूरत भी है कि हर स्टूडेंट हो या प्रोफेशनल हो अपना स्टार्टअप से जुड़े तो जॉब सीकर्स के लिए एंटरप्रेन्योरशिप को हम प्रमोट करना चाहते हैं कि प्रॉब्लम एंटरप्रेन्योरशिप को ट्राई करें
अतुल सर आपका आवाज कट रहा है अतुल सर आपका आवाज क्लियर नहीं आ रहा है yes
so we'll give another 5 minutes so and then we'll
wait for a few other people to join ठीक है अभिषेक जी
जी
तो मैं
चंदन जी आप कोऑर्डिनेट कीजिए
Yes. So we will wait for another couple of minutes. Let some more people to join.
Sir, good evening.
And
good evening.
Good evening.
Yeah, Bharat Bhushan.
So we will start.
Yes, Bharat Bhushan. Yes.
Thank you. Welcome, Bharat Bhushan ji.
And good to see you after a long time.
Thank you.
Although I am traveling, but I'll be attending this session.
Oh, that's thank you, Bharat.
Thanks for the invite. Thank you.
चंदन जी एक बार एन के बारे में बता दीजिए ना एन क्या करता है
So basically the idea of Young Entrepreneur Network was to help and support all the fellow entrepreneurs, the entrepreneurs who are already into the entrepreneurship or would like to become an entrepreneur. And what we thought is that there are a lot of things one entrepreneur requires, from setting up a company to having a business plan and to having a financial plan, websites. Also with a network of people, and then through the network only one can get help from each other. That was the basic idea of setting up this Young Entrepreneur Network. But since we all are going through such a difficult time, so we also thought it is very important to how to survive. Survival is very important. And since this is such a new thing, many of the people are not actually aware what exactly it is, because we are getting a lot of information from a lot of sources. So it is always very important to get the information from authentic source. And a medical doctor is definitely a best person to inform anything about and everything about the disease like such. So Dr. Mascara is NHS doctor in UK. He did his MBBS from India, and then he moved to UK and he worked in other countries as well. And from last more than 1 decade, he's in UK and helping people. He's a teacher also. He teaches to the PG students of the medical science. And so he is going to talk about next 15-20 minutes. He is going to talk about the facts and the myths of the coronavirus. He will be sharing a presentation to us. And after 20 minutes, I would request all for this first 20 minutes, I would like people to keep their mic on mute for avoid any disturbances. And after 20 minutes, 25 minutes after finishing the slides, we can open a question answer session and you can ask anything you want to Dr. Muscara for any clarification, any information, anything you want. So over to you, Dr. Muscara, we can start.
Thank you, Chandan, for the generous introduction. First of all, I would like to thank Young Entrepreneur Network, YEN, and the founders and the co-founder, Atul, Chandan, and Abhishek for giving me this opportunity to talk to you, all of you. And it's my honor and privilege to be here because I am very close to India. My family and my extended family are in India. So my heart is in India at the moment. And since this pandemic started, that is last year, I can recall 23rd of March, 2020, when first lockdown in UK happened. This topic, the COVID, you won't believe, I mean, I'm getting 24/7 phone call from India, from my family and my extended family, because I'm the only doctor in my family tree, and I'm the first person to go to university, do a medicine from my town. So
म्यूट है अभी मामा कुछ निकाल रहे थे कोविड के बारे में
can you hear me? Can you hear me?
Yeah. Parth ji, excuse me.
We can hear. Can we unmute others?
Can I request everyone to stay on mute? And once this talk is over, then we will open the floor. So I'm going to talk about myths and facts regarding this COVID-19, which is, as I said, very close to my heart in the form that this is a pandemic as described by WHO. And this has caused lots of morbidity and mortality. Till now, 3.46 million of people have lost their life, and there has been 160 million cases recorded worldwide. So before I say something, I thought I'll talk about myself. So I was born and bred in Bihar, India. I did my primary schooling from Gandhi Shikshan Sansthan, Ratanpur, Begusarai. My secondary schooling was from Military School, Science School, Tilaiya, Jharkhand. And I was very fortunate to have studied from one of the most prestigious medical colleges in India, Christian Medical College, Vellore, Tamil Nadu. And after doing my primary medical schooling, I migrated to UK in 2003. I did my higher specialist training in family medicine from Scotland, UK. And I did my membership and fellowship from Royal College of General Practice, London. I am very passionate about teaching and training. That's why I'm here today to give you some of the facts and the myths about the COVID. So I like teaching medical students, junior doctors, family physicians, and for that I had to undergo a training called postgraduate medical studies, postgraduate certificate in medical education, which I did from London. And I'm also a fellow of the Royal College of Australia. So I did work in Australia for 2 years as a family physician. And I have been family physician in UK since 2011. I've been very fortunate that I have been sitting on a few committees in UK. I'm a specialist advisor on the Care Quality Commission. So before we give any accreditation to any health facilities like polyclinics or any hospital, we have to go out and see whether they meet the basic standards. And I also sit on the thorough clinical commissioning group, which is involved in commissioning various activities in UK, like in the Essex area, like vaccines and COVID task group. I also appraise my colleagues. I'm a trainer, as said, Chandan has mentioned earlier, and I'm also a board member for various Royal College committees. So now I'm going to talk about the COVID infection. So as I said, the COVID has been declared as a pandemic by WHO, Health World Organization, and so far 3.46 million people worldwide has lost their life, and 167 million people had this infection. However, I can tell you the good news is that 95 to 98% of this COVID infection, people do recover on their own. It's a mild viral illness. So what do I mean by that? So I know people may question me that they say, how can I say it's a mild illness? Yes, I can reassure you, 95 to 98% of people, they don't need any fancy treatment. It's a mild viral illness. Your body will fight against this infection. So, so in summary, there's no need for giving plasma, giving remdesivir, Faviflu, ivermectin, hydroxychloroquine, antibiotics, or even steroids or blood thinner in all these mild cases. So you need only treatment for people who are severely affected, and these are 1 to 2% of people who have an underlying illness. So what do you mean by underlying illness? Underlying illness are people who have diabetes, who have a heart condition, who have chronic kidney disease, who have suffer from who has a cancer, who are immunosuppressants, and who are undergoing some chemotherapy. These are the people who are classed as more vulnerable to catch this infection, and these are the people who fall into this 1 to 2%. And then you can ask me again that how come, and it's really heartbreaking to see that this time the COVID, the second wave has affected lots of young people, young, fit, healthy. I mean, I have lost my mamaji's son, who's only 32-year old. So you'll ask me, how come this happened? And he was fit and healthy. So yes, I would say probably few unlucky one also falls into 1 to 2% who were young and fit and healthy. As I said, we don't know much about this virus, and we are learning about this virus as the day go by, because it's a new illness. So no one actually knows how this virus attacks young, fit, and healthy people. But however, the numbers are very, very small, and it will only affect people who have. When you are more susceptible if your sugars are not under well control, if you have kidney condition, if you have any underlying heart problem, or if you're on immunosuppressant therapy. So how to manage these 1 to 2% of the people who get severely infected and who are affected? So we have to remember that all the resources have to be reserved for this 1 to 2% of the people who are severely ill, not for the other 95 to 98% of people who get mild illness. So you might remember that last year, the Prime Minister of UK, Boris Johnson, and ex-President of United States of America, Donald Trump, he also had this illness. So this illness doesn't spare anyone with power, wealth, contacts, influence, caste, or creed. It can affect anyone. So no one can escape from this virus. And the point which I'm trying to say that all the hospital beds, oxygen, doctors, nurses, they need to concentrate on the 1 to 2% of the people who are seriously ill, and not on the other 95 to 90% people who don't need our attention. So the only thing needed for the 1 to 2% is oxygen, for everyone, in fact, oxygen level monitoring. So let's take a step back. So what are the symptoms? I mean, how do you recognize if someone is having COVID infection? So because it's just like any other illness, any other viral illness. So people will have high temperature, you have body aches, headache, cold, cough, and then you can have a loss of smell. And then some people have shortness of breath, and then oxygen level can go down, and then you get chest pain. So till you have shortness of breath, your oxygen level goes down, you get chest pain. I don't think there's no need to panic if your oxygen saturation is more than 92%. So no need to panic if your saturation is more than 92%. There's no need for hospitalization. You just need to stay at home. You need paracetamol, which is crocin or dolo, for fever, body ache, and home isolation. Home isolation is very important because with that you're going to protect your loved one, and then and in that way you're stopping the spread of the infection. So home isolation is very important from that aspect. I still remember just a few months ago I had a call from one of my nephew in Mumbai, and he said that he, uncle, auntie, and my niece and nephew, 5 of them, all were found to be positive, and none of them had any symptom, and everyone was having 10, 15 in the medication. And so I said, why? There's no need for medication if you are not symptomatic, if you don't have any of the symptom. You just need to isolate and have plenty of fluid and paracetamol if you have fever or body ache. So the point I'm going to make, 1 in 3%, in fact, a study from India showed that 1 in 2% are asymptomatic. That means you are carrying the virus, but you don't have symptoms. So then you don't need any treatment. That's what I want to make this point very clear. If you don't have any symptom, you don't need to take 10, 15 medication, which I have seen in over last few months. Everyone from India, they're sending me the scripts, and everyone is on 10, 15 medication. You don't need that. That need to stop. Now, going back to the oxygen shortage. So it was, again, I mean, I have been following the news very closely on iTech and NDTV, which is available in UK, and it's really heartbreaking to see that people are not getting beds. There's no oxygen supply. There are no ICU beds, and people are dying because of the oxygen shortage. And I was really surprised. I mean, I couldn't believe. I was told recently that people were getting bed in the hospital, and they had to sign a contract saying that the relatives of the patient, they have to arrange the oxygen. I mean, I can't believe. I mean, how can you have to arrange the oxygen if you have gone to the hospital? When no one in Western country will believe this. But this is happening in India. I can see. I have seen so many WhatsApp messages of people asking people that where they can get the oxygen. Let me tell you, you don't need oxygen at home. If your saturation is below 90% or 92%, you have shortness of breath, then you need to go to hospital. So that will be only the case for 1 to 2%. Another 95 to 98% can safely stay at home. There's no need to panic. There's no need to hoard. There's no need to get oxygen cylinder and keep at home and deprive people who need that oxygen. So now let's talk about the 1 to 2% of the people who will need oxygen, and so so UK, as I said, we are still learning about this virus as the day go by. And in first wave, there were lots of casualties in UK. Morbidity and mortality was very high, and the only thing they found that people who were hospitalized in UK, they benefited was oxygen therapy, steroids, and blood thinners. But just to make this clear, this was beneficial in people who were admitted to the hospital, not in the community, not at home. So oxygen therapy, blood thinners, and steroids are for people who are admitted to the hospital. But now some of the studies have shown that if someone has shortness of breath, oxygen saturation is borderline, say 90-92, person is not that ill, early steroid therapy can help. Even I have gone through the All India Institute of Medical Science in India, the guidelines, and they have endorsed that early steroid therapy is helpful. So dexamethasone, 6 milligram, 12 tablets once daily for 7 to 10 days is beneficial. If you don't get dexamethasone, you can take methylprednisolone or prednisolone in equivalent doses. I thought it would be good to touch on black fungus disease. I think I have heard quite a lot about this recently in the media, and then black fungus is on the rise, and lots of people are losing their life. So what is black fungus disease? And so the scientific name of black fungus disease is called mucormycosis. And how come this has become more prominent recently? So what happened in black fungus disease, also called mucormycosis, this is found in, actually this fungus is a normal resident. It's there in the environment. It's there in our nasal mucosa. It is a normal resident there. But people with diabetes who are having uncontrolled sugar, their sugar is not under good control, people who are immunosuppressant, or people who are having a COVID infection, these people are more prone to get this infection, the black fungus or mucormycosis. So how do you identify? How do you know that someone is having this infection? So there's a few things. One is you will get blackening or discoloration over the nose. There will be blurring or double vision. They can have chest pain, shortness of breath, coughing, or headache. So this is a medical emergency actually. So if someone has any of these symptoms, they shouldn't be sitting at home. They should immediately seek medical help. They need a CT scan of the face to detect the infection, and then they need hospitalization for antifungal IV amphotericin. which is the treatment and which is a life saving. So this is a very deadly disease, and this needs to be tackled, which you cannot do at home, and you will need hospitalization and an expert opinion treatment. Now, going back to some of the other medication and other therapies, which was quite widely publicized on the social media and was in the news recently, and whatever I'm going to talk to you today is about the UK experience and what the science, what is the evidence-based medicine behind that. Because I know that lots of things people are doing in India. I am not blaming anyone. I know everyone is trying to help, but I'm just talking about the what is the science and what is the evidence behind anything you do, because in UK everything is evidence-based medicine. If there is no evidence, nothing is. So you won't believe that none of the antibiotic which is given in India, like doxycycline or ivermectin or Faviflu, there's so many. None of them are we are allowed to prescribe them. We are not prescribing any one of them because we are not allowed to prescribe. It has not been approved by the UK government or UK Scientific Advisory Committee. So they did. So I'm going to just take a few of them, like plasma. So in the beginning, in the first wave, they were saying that plasma therapy is quite helpful. So they did it's a very large trial in UK. So they had 11,000 people whom they gave plasma, and another 11,000 they didn't give plasma. But however, they didn't find there was any significant benefit with the plasma therapy. So that was discarded. So here we are not giving plasma therapy anymore. Hydroxychloroquine and ivermectin, again, they have not shown there's any benefit of giving hydroxychloroquine or ivermectin. Then about the rationing of resources. So as I said earlier, that it is very, very important that who goes to the hospital, who gets an ICU bed, because everyone is in panic, and if people panic, then there could be lots of mistakes. So I think we need to really come out of that mode, and we really need to be more sensible, be in charge of ourselves. And as I said in my talk early on in my presentation, the 95 to 98% of people, they don't need any treatment. They can be safely managed at home, and that was the strategy which was used in UK. That most people were managed at home with isolation, with the testing, isolation, and good hydration and paracetamol. That's what it was done. Only 1 to 2% of people who were having low oxygenation, who were unwell, really unwell, they went to the hospital and they got the hospitalization and they had the ICU bed and they had a good recovery. Unfortunately, some people did die, and it's very sad and heartbreaking. But this is the illness we are dealing at the moment. Then I'm coming to the next question. So one of the questions people did ask, that once you have the isolation and once you've been tested positive, do you need to retest it? In UK, once if you have been tested positive, you have to isolate for 10 to 14 days, and after that you don't need to retest, because that's unnecessary. It's really wastage of resources and putting extra strain on the system. So once you had 10 to 14 days of isolation and you don't have any symptom, you can come out, you are considered as a non-infectious. So, and there's no need to test. So I just want to repeat, there's no need to test again. And at this point of time, I would like to tell you again, I received so many reports from India, CRP, D-dimer, CBC, ferritin, there's so many, CT scan, people who have no symptoms, and they asking me to interpret. Let me tell you, don't need to have any test if you don't have any symptom. If you have shortness of breath, if your oxygen saturation is low, you are unwell, that's the only time you need to seek opinion from physician and get some help. If you are not unwell, if you are asymptomatic, if you are tested positive, still you don't need to have any test. Okay, then I thought it might be useful to go through a few of the slogans and few of the things which can help to prevent COVID-19. So these are a few things in UK which work very well, and I thought it is a good platform for me to bring this here and discuss with you. Hand, face, and space. So most of the time we find that if you have a good hand hygiene, you can spread most of the infection from spreading. So advice is wash your hand at least for 20 seconds with soap and water. And you should carry a small hand sanitizer in your pocket and then sanitize yourself. If you don't have any washing facility in your close vicinity, then at least sanitize your hand. Face. In India, this COVID has been now has been classed as airborne disease. So they advise that you should always have double mask whenever you go out or you face anyone. You should have. So in UK, you won't believe it's more almost 1.5 year, and since the face mask or face covering was implemented, that was in May last year. Since that day, I have never gone out without a face mask. I always have one face mask in my pocket, or anyone going out of the house, or anyone in a building, and if someone comes to talk to them, you always have to have a face mask. Without that, you're not allowed to enter into a shop or go anywhere. So face mask had to be must. And space. Space, what do you mean by space? So a close contact is defined as if you have a contact with a person for more than 20 minutes in the same room, and the distance is less than 1 meter. So in UK, this what they did. They said that the social distancing had to be 2 meters. So if you want to talk to anyone, they have to, or you are standing in a queue, or you're waiting to get your turn. You have to have at least 2 meters distance from the person standing next to you. So that is the space. And all the studies have shown that you have more chances of catching this infection if you are indoors than outdoors. So wherever, if you're sitting in a room, or in a house, or in a building, see if you can open the windows and the door, so that you let the air circulate, and you have less chance of catching if you're outdoors. So if people are not outside, and if if it's not crowded, it's quite safe place for you to be. Then second thing was test, trace, and isolate. So if you have symptoms, and you have, because it is a very such a confusing illness, because all the symptoms which you get are similar to the one you can have in any normal flu like illness. So in UK, we are very lucky that we don't everything is free at the point of source. So you and test is very easily available. Anyone can book a test if you have a symptom. So I don't know how much facility you have in India, but if possible, try to get it tested. So the two advantages of getting there are two advantages if you get tested. One, you know that you have this virus, so you are more serious about it. And secondly, you isolate. So once you isolate, you're protecting yourself, and you're protecting your loved ones, your family, and everyone else, so that you're not spreading the infection. And trace is in UK, the government launched an app which we all had to download, and then all the people, once you are tested positive, all the people who came in your contact, they were tested for this virus. So that's how that was one of the slogan: hand, face, space, test, track, and isolate. And the third one is stay at home. I know it is difficult. In UK, we're lucky the government is very supportive. So more 90% of the people who were not frontline workers, yeah, we were frontline workers like doctors, delivery drivers, and and the pharmacist. So we had to go for work, but 90% of people stayed at home, and then and there was we are still in partial lockdown in UK. 4 months we had complete lockdown, and that's how we were able to contain the virus. And this is the sacrifice we made. I can tell you from my experience, for last 1 year, we have not uh, gone out to any restaurant. We have not met people, and people have not come to our house. We have not gone to their house. So these are sacrifices we made so that we don't catch the virus, and we don't give it to anyone if we are carrying it asymptomatically. And then 4 to 5 months, the whole UK was under lockdown. But that is a political decision. I won't go into that. But I would say at the moment, the virus is circulating very widely in India. So I would urge everyone, if possible, to stay at home, at least for this month, and maybe first half of the next month, if possible, and do follow all the social distancing advice, and hand sanitization, and wear the face covering. This is the only thing which is going to protect you and save you. And if possible, try to distance. Don't attend any parties or function or meet people for next 1 to 2 months if possible. Okay, vaccine. I thought it will be good to talk about vaccine here. So vaccine. So once there was first lockdown in UK on 23rd of March, and then all over the world there were lots of work going on the vaccine. And so before the vaccine was launched on 2nd December 2020 in UK. That was the first vaccine, the Pfizer, which was given a green signal. Before that, all the hospitals were full, all the ICU beds were full, and and it was chaos. I mean, a lot of people were dying. There was high morbidity, mortality, whatever you do. And after that, the vaccine was launched. It was rolled over. It was started with all the frontline worker, elderly people, and then slowly now 75% of UK population has been vaccinated. So within 3 months, within 3 months of vaccine rollout, we found that number of hospital admission, number of ICU admission, number of death, morbidity, mortality, everything just plummeted. Mm. So we have found that vaccine has been a game changer other than your social distancing, lockdown, mask, and hand hygiene. So vaccine. So my plea to everyone will be that whenever, if possible, whenever you're offered a vaccine, please go and have it, because that's going to really protect you. And then I have some data on vaccine too. It's not that I'm just talking from my experience. There have been lots of research on the efficacy and effectiveness of the vaccine. So what they have found that if you have one vaccine, then within 3 to 4 weeks, it gives you up to 65% protection. And once you have second vaccine within 12 weeks of the first vaccine, then from 3 to 12 weeks, you can have the second vaccine. Then it gives you 92 to 95% of protection. Then, as I said, this is a very different sort of virus. We're still learning about it, and no one knows how long the immunity lasts. But the Pfizer company, the company which first launched this vaccine, the Pfizer BioNTech, and they say that they have found this vaccine is protective for 91.3% of people, 91.3% protection at least for 6 months. So in UK, the government is now planning to give third dose in October, because October is the time we are expecting upsurge in the infection due to the international travel and other things. So they will have probably, if everything goes well, they plan to give a third dose of vaccine in October. But for Indian context, I will say that yes, I know there's a lot of scarcity of vaccine at the moment, but I would urge everyone to please go ahead and have the vaccine when you are offered. Please go have the vaccine, because this is one which is going to change you. But however, then you will ask me, I have seen and heard, and a lot of people have contacted me and asked me this question, that what happens, people are still getting infection after vaccine. Yes, I totally agree. After first and second vaccine, people are getting the infection, but numbers are very far and few, and the infection which you get is mild. You the good news is that most probably most of the people will not need hospitalization or ICU admission. And if few people have had, then they had very severe underlying illness. So I'm talking about the large majority of people. Yes, I know very few people still might get the infection, but at least most of the people will get protected. So please go have the vaccine when you are given when your turn comes, or when you are offered a vaccine, because that's going to really help you. And you need 2 doses of vaccine at the moment, and as I said, third one is under research, and most probably in UK they will give it in October. So summary. So today, while I was preparing my talk, and then I came across this on the social media, and I thought I'll share this with you, which is quite nice. So see, and this is these quotations have been taken from one of the doctor from Fortis Hospital on the social media, and it said that no nation in the world will be able to control COVID by increasing the number of beds, oxygen cylinders, ventilators, or ICU wards. This is temporary, impossible, and very expensive solution. I totally agree. I totally agree with what's said here. And if healthcare infrastructure was the answer, then developed Western country like UK, US won't have had so many COVID cases. They won't have had so many mortality and morbidity. I totally agree. Yes, we have all the infrastructure in the world. We have the latest technology. We have all the ICU beds, ventilator, oxygen, but still more than 100,000 people lost their life in UK, and many more in US. So yes, I agree. The healthcare infrastructure is not the answer. The long-lasting, inexpensive, and the quickest solution is social distancing, wearing mask, maintaining high level of hand hygiene to stop infection, stop the transmission. So remember, hospitals are not built to stop the road accidents. They can only be stopped by careful driving. And I totally agree. So please remember that the solution, the long lasting, inexpensive and the quickest solution to have a victory over this the COVID infection is social distancing, wearing masks, and maintaining high levels of hand hygiene. Thank you very much for your time. And as I said, it has been my honor and privilege for this presentation and the opportunity given to me. I will hand over to my coordinators and Atul and Chandan Kumar for arranging this
we
talk.
will rejoin for same link. We will rejoin because
so Chandan Kumar,
limitation of
so now
40 minutes.
Now the floor will be we'll open the floor for all of you. If you have any question, you can either use the raise hand button on this Zoom, or you can put your question in the chat.
Namaskar, Dr. Saab.
Namaskar.
Yes. Yeah, before we start, just want to tell that if there is a disconnection because this link was valid for 40 minutes, please rejoin